I think that leads to the next question. How long do the symptoms typically last in babies?
Yeah, so it depends, of course. I feel like it's so probably frustrating for parents and just in general. The answer is always like it depends. Every baby's different,
Yeah.
right? But it depends how much drug they were exposed to in utero. Like I've seen babies who have over a month of these symptoms because their moms were just taking so many drugs in such large amounts that they just got so used to that and they were in severe withdrawal. So they have been on the morphine medication for weeks and weeks just to be able to tolerate coming off of it. But I'd say that that's a more rare, extreme circumstance. So, in terms of them being monitored and hospitalized, that would only be if they're still on the medication or still having severe withdrawal signs. But even after they go home, the research shows that they can have more like minor symptoms, like they might just be a little bit more agitated, and that just might take a little bit of time to wear off. So, yeah, there's no definitive set amount of time, unfortunately. We typically see the withdrawal starting, we see the symptoms within a few days. However, if the mom has been on methadone, for instance, that can actually take up to like 2 weeks for us to start seeing the withdrawal. So even if you have a newborn baby and they've been home with you and you think, oh, why would they be showing signs and symptoms of withdrawal now? Well, maybe if the mom were on methadone, it might be a delayed.
Well, actually, I just switched questions really quickly because someone did say if a baby's exposed to methadone, do hospitals wean them off or go cold turkey?
So is that if the baby's taking methadone or the mom was
If
taking
the mom is
methadone?
taking methadone and the baby was exposed in utero.
Yes, so they may or may not actually need pharmacologic management. They may or may not. Sometimes we give the babies methadone, so plus or minus there. But in general, it's always a wean. If they're on medication, whether that's morphine, methadone, sometimes we put them on clonidine. In general, we're always titrating back or weaning down that dose. We really don't do anything cold turkey.
Do you know if there's any longer term effects with meth? I feel like methamphetamines is in a different category than opioids
Yes,
because
definitely.
it's not an opioid, right? And some people are more scared of methamphetamines. And do you know anything about the
Yeah,
difference there? And yeah.
Yeah, I looked into kind of long-term outcomes because I knew that was a question when I presented this back a couple of months ago. Um, so we talked previously about some of the minor signs and symptoms of the drug withdrawal may continue for even a few months after discharge from the hospital. And so they're kind of more long-term prognosis. Infants who are exposed to any drugs, they may have some neurobehavioral problems. That's kind of a given, anybody can imagine that, and it's kind of a wide array and a wide spectrum of what you're going to see. So I'll go through the long term, what the studies have shown in terms of opiates as well as cocaine exposure. So for opiates, they're saying at 5 to 6 years of age, these children appear to develop to function within normal range with mental and motor development. So that is good news. At age 9, they've seen that some of them have some lower scores in terms of some language processing, and they may require some special education classes. But most importantly, they're saying that a positive and reinforcing environment can improve these outcomes drastically, which I'll say for anything that your child goes through, getting them into therapies, early intervention, things like that sooner rather than later makes all the difference. So any kid that was exposed to any sort of a drug, I think it would be good to have them followed closely in terms of their developmental milestones. If they are lagging behind at all, getting them into therapy early, whether that's speech therapy, occupational therapy, physical therapy, all of those things make a huge difference, especially when you start them early, the sooner the better. So with cocaine, the studies that I found, and methamphetamines would kind of fall into the same category as well. They're saying there were no major deficits in the motor development after the exposure to cocaine. They did have more behavioral problems when they were followed up, but it totally depends. There's a wide degree depending on their exposure during gestation, so during the mom's pregnancy. And then they did find that children who were exposed to cocaine and methamphetamines are more likely to be referred for special education services at school. So that might be like an ADHD type situation or just some learning disabilities, things like that, which makes sense just because, of course, if you're starting off in that space of overstimulation to your brain, it's harder for your brain to develop normally. But the good news is a lot of these things can be overcome. And I do think with caring parents who are involved, it can really make a big difference for all kinds of
S-
different
So
circumstances.
cocaine is not an opioid, but
Correct.
heroin is an opioid. As
Um,
if I
oh gosh, I know. I'm definitely not like an expert, but yeah,
okay.
heroin is an opioid. Yes,
Yeah.
that's it.
Okay.
The
It's
opioids are
really
considered like codeine, heroin, methadone, morphine, fentanyl, oxycodone. Yeah,
and I was asking you before, you haven't heard of fentanyl having a different type of special outcome than the rest of the opioids. It's kind of just lumped in there.
not as far as like babies. I mean, fentanyl is a very very scary drug, and I've seen reports in the news. It's really sad about teenagers or whomever. They don't know that something's laced with fentanyl.
Mhm.
Fentanyl, we're even cautious to give it in the hospital setting because it can cause somebody to completely stop breathing. So we are very cautious even in the hospital. If you need it, you need it, but we just give it very slowly. And of course, you're being monitored. But for somebody to be taking that as a street drug is really, really scary. So it's definitely in a class of its own, I would say. But in terms of the babies and their reaction and their withdrawal, personally, no, I haven't heard that the babies are having more withdrawal. I would say it's probably pretty similar. Again, it depends on the dose and how often the mom was taking the drug, but in general, it's acting pretty similarly to like morphine. It's just shorter acting. So sometimes we'll give it if we just want a shorter acting effect, if like somebody's having a procedure and they just need that analgesic effect for a shorter period of time. It's fast acting, it's shorter acting, whereas morphine is more long term.
Okay, great. And I know a great resource is mothertobaby.org, which is something we share with all of our families after our first call with you. But that's, you can look up by drug and it'll kind of tell you what's been studied. Does any research show that babies exposed to drugs in utero have a higher tendency to use or be addicted in the future? Do you know anything about that?
Yeah, that's a good question. I do know addiction in general, there is a genetic component to it. So yes, I would say more than likely. Um, Yes, I don't have a definitive study to show you, but yes, there is a genetic component to addiction, unfortunately. So, oftentimes, when mothers are doing these street drugs, especially during pregnancy, they do have a legitimate addiction. And so, a lot of that would put the child more at risk for having a more addictive personality, being more likely to get addicted to drugs. So, that would just be you want to monitor your child closely if they have a dental procedure and somebody prescribes them oxycodone or whatever. You always want to be very careful with those substances, not leaving them around the house. For adults, too, you just have to be careful with these substances because for one person, they take the oxycodone after their procedure and they just take it a couple of days and then they're fine and they're done with it. But other people who are more at risk for becoming addicted, you just have to be a little bit more cautious. So I know I even have some personal friends who they just say, nope, I don't want that. It runs in my family and I'm at high risk for having an addiction. So I don't even want the prescription for the oxycodone. I'll take my Tylenol or something. So
Yeah.
yeah, I
And
would
and I
say
know that you are a NICU nurse, so you see a lot of things, including drug exposure and everything. But there are specialists that specialize in adoption medicine and really know what each of these, this is what they study in particular. So certainly we have resources for that if you're interested, like the University of Minnesota Adoption Medicine Clinic, and there's others as well where they can do consults with you one-on-one to actually look at specific situations if you are interested. You have to pay for that, but they're really, really great. So I don't know if you're able to answer this, but what are the specific drugs that babies are more likely to successfully withdraw from? And what are the drugs that babies are more likely to be affected by long term? Do you have any insight on that?
I don't know that it's like drug to drug specific. I think it's more so what was the dose and what was the longevity. what was the amount of exposure. So longer exposure, more severe withdrawal. I don't know that it doesn't really matter which opioid or which narcotic the mom was taking. It's just a matter of how much was the baby exposed, how much did they become used to that in utero, whether the mom was doing the drug frequently or doing a large dose of the drug, then you're going to see a more severe withdrawal. And then you say successfully withdraw from, I would say they all eventually like have success with overcoming their neonatal abstinence. It's just a matter of time, and every baby's just going to be a little bit different in terms of what they require to manage the condition and how long it's going to take to, as you say, successfully withdraw or overcome that condition and be able to function and grow and things like that. We don't want them burning all their calories because they're so stressed out. We need them to get into a calm place, and that would be considered successful, right? When they can just move on with their normal development.
Yeah. How about alcohol? And I think I was going to say, but alcohol I know is the worst, right?
Right. So a mom would have to be ingesting a large amount of alcohol for us to see what's called the fetal alcohol syndrome, or FAS. Um, so the risk of an alcoholic woman having a child with fetal alcohol syndrome is around 35 to 40%. So it's almost like that's a little bit less than I would imagine I would think. But there is increased risk of having congenital anomalies, so just deformities like with the development when the baby's in utero, and then impaired intellectual capacity as well. So it can definitely lead to irritability, like we've talked about. It would probably present a bit differently, not exactly the same as we would see with an opioid withdrawal, but they can have some irritability. Again, they're withdrawing from the alcohol. If they were significantly exposed, it does cross the placenta. And then they can have some hyperactivity in their childhood as well. And then if they do have this significant fetal alcohol syndrome, we will see like facial dysmorphology. So we'll see some facial features like a small head, small eyes, things like that. And then some of the nervous system symptoms that we discussed previously with that hypertonic state and that irritable type state.